In today's Frontline Diaries segment, we're joined by RN Kristine Belmore. Kristine, thank you for being here.
Thank you.
So you worked in the ear, nose, and throat department, as it were, basically in respirology. And when the pandemic landed, I understand that whole area was transformed into the COVID floor.
It was. So we got the announcement maybe a few weeks before all of this happened. So it was a pretty quick transition from, what we were used to having our surgical patients to then clearing all of them out and receiving some COVID patients. So it was a complete change for us. We had to change a lot of things, the way that we took care of patients, the way we worked as a team. It was just completely different what we weren't used to before. So
Do you remember that day way back in March when the first COVID case was admitted to the hospital?
I do. Yeah, I was working. There was a lot of nerves, but we also didn't really know what to expect. We didn't know if these patients were going to be here for a couple weeks or if this was going to last maybe a couple months. I don't think any of us expected it to be this long and this difficult of a year.
And you've been an RN for how long?
It's been 11 years now on this unit.
And did it make you feel like you were back in those brand new days of nursing where steep learning curve and you're kind of figuring everything out all over again?
Absolutely. And especially when you're a new nurse, you have those anxieties before you come into work. You're the night before, you're maybe not sleeping as well. You're trying to anticipate what your day is going to be like. I think a lot of us had that feeling again, where you didn't know how many cases were you going to have the next day? How sick was your patient going to be? How busy was your day going to be? So I think a lot of us had restless nights and, just not knowing what to expect. It was just very unpredictable.
It has been a really long haul, even for those of us who are not on the front lines, who are not immersed in this. This has just been a long, long year for a lot of people. How have you coped with that? What kind of toll has that taken on you and your family?
It's definitely been very challenging. It's nothing we've ever faced before. Just the emotional stress that we endure at work every day, taking care of COVID patients. And then to go home and, you're not having the same supports we were used to. Our kids aren't in school. We're not able to visit family who used to, help out with the kids.
And your kids are 4 and 6, is that right? Do they get it, do you think? Do they know how different everything is, or they're just happy when mom comes home?
I think they are definitely happy when I'm home, but it's difficult for them as well, not to see their friends and especially not to see their grandparents, not being able to do those sleepovers they loved. I think it's for my son who's so young, it's kind of now become a new normal for him. So, we Purell, we wear our masks out. He's very adapting very quickly. However, it's definitely difficult for them as well.
All right, Kristine Belmore, we thank you so much for your time today and thank you for everything.
Thanks for having me.